Well, surveyors from the California Department of Public Health visited Northern Inyo Hospital for a licensing survey July 21st and 22nd. Now, a press release notes that the hospital can now provide improvements for its patients, including swing bed increase. Now, the state granted Northern Inyo Hospital 5 additional swing beds, bringing its available total to 10. Medicare allows certain small rural hospitals to use its beds as needed, either for acute care or skilled care. Now, this allows physicians to swing patients from one level of care to another while staying within the same bed and the same facility. Press release notes a good example of a swing bed stay is when someone undergoes joint replacement surgery. A swing bed allows patients to recover in a hospital setting versus a nursing home. Now, in the hospital, patients have easy access to nursing care and rehabilitative services, including physical, occupational, and speech therapy. Now, the goal of swing bed programs is to help patients becoming as independent as possible before discharge. Also, the Rural Health Clinic exam rooms have been added. Rural Health Clinic's family practice now has 3 additional exam rooms. The additional exam rooms are expected to ease patient flow and should reduce the wait for patient care at times at the Rural Health Clinic, which experiences about 24,000 patient visits per year. Now, in addition, women's health care services are now part of the RHC, housed in the adjacent building connected by a ramp and/or walkway. Now, these services will include obstetrical care, well women exams, and minor gynecological procedures. Now, the RHC family practice will continue to provide family practice and/or primary care, preventative care, chronic disease management, and acute illness care. Patients making appointments can call 760-873-2602 for women's health or 760-873-2849 for family practice. Also, the Infusion Center will be relocating. The new Northern Inyo Hospital Infusion Center will now occupy a much larger space within the older main hospital off Pioneer Lane. The press release notes that what makes the new space unique is that it offers 5 individual exam rooms, enhancing privacy for patients. Northern Inyo Hospital nursing staff is working to make the new location a warmer, more welcoming place for patients to undergo treatment. The infusion center is expected to begin operations by early fall. Now, infusion therapy is the intravenous administration of medication and is most often used when oral medications will not work. For many people, chemotherapy for the treatment of cancer is the most familiar type of infusion therapy. Other types include intravenous antibiotics and therapeutic infusions such as iron replacement and infusions for bone health. Also, Northern Inyo Hospital has added a new pediatrician to its children's health team. This took place last week as Dr. Louisa Salisbury arrived for orientation and will begin seeing patients the week of August 17th. A native Californian, Dr. Salisbury comes to Northern Inyo Hospital by way of New England. She is a graduate of the University of Vermont's College of Medicine and completed her pediatrics training at Boston's Tufts Medical Center. Now, a press release says pediatrics is a natural fit for Dr. Salisbury, who could not recall a time when she wasn't interested in working with children. Said Dr. Salisbury, quote, "Children are just the best. They want to get better. They want to get back to playing, and they are so resilient. Plus, there's the added perks of getting to know their families and watching them grow up," end quote. Dr. Salisbury is passionate about preventive pediatric care and believes strongly in the health benefits of an active lifestyle. She personally enjoys biking, hiking, skiing, and climbing, and press release notes hopes her patients will turn playtime into a lifestyle choice as adults. Dr. Salisbury joins Dr. Charlotte Helvey, MD, and Colleen McAvoy, certified pediatric nurse practitioner at Bishop Pediatrics and Allergy. That is also located Pioneer Medical Building, Northern Inyo Hospital Campus, Pioneer Lane. Appointments can be made at 760-873-6373, and you can see more on these stories on our website, sierrawave.net. And the Mono County Health Department put out a press release about the new school year, saying getting all of the recommended vaccines is one of the most important things a parent can do to protect their child's health, especially when they are in a setting like a school or a child care center where disease outbreaks can occur. Whether it's a baby starting at a new child care facility, a toddler heading to preschool, a student going back to elementary, middle, or high school, or even a college freshman, parents should check their child's vaccine records. Now, when parents are preparing to send their child off to daycare, school, or college, a press release notes perfect time to check to see they are up on the recommended vaccines. Child care facilities, preschool programs, schools, and colleges highly susceptible to outbreaks of infectious diseases. Children can easily transmit illnesses to one another due to poor hand washing, uncovered coughs, dense populations, and other factors. And when children aren't vaccinated, they are at an increased risk for disease and can spread disease to others in their classrooms and communities. Now, this includes babies too young to be fully vaccinated and people with weakened immune systems due to cancer or other health conditions. And the press release notes now is the time for parents to check with their child's doctor, school, or the local health department to learn about the requirements. You can see our website, sierrawave.net, for much more on this press release. Well, I'll tell you what, we'll come back with a weather report and a look at the two gentlemen of Verona.